Morning, good afternoon, good evening. I'm Paul Gunterson, the Director of KWASH at the Stone Family Foundation, and I'm delighted to welcome you to this session on the final day of World Water Week, which is focused on exploring the complementarity of different service delivery models to achieve universal water coverage. Fridays at the conference are generally very quiet after a long week of discussions and events, but it's great to see and lots of attendees, and we're really hoping that this discussion will be a fruitful one. Before we start, just want to flag a couple of technical things. We really want to encourage participants to interact and ask questions throughout the session. You can do that using the Pathable chat function. We will try to have 2 Q&A points during the presentation, during the session, which the speakers will try to answer some of those questions. And just to let you know that the session, like most of the sessions at World Water Week, is being recorded. Before we dive into the discussion and to hear more from our speakers, who I'll introduce in a minute, I want to place the discussion in the context of the latest data from the JMP report, figures that have been quoted and discussed throughout the sessions this week. What we can see is that 1 in 4 people lacked safely managed drinking water in 2020. And we know that we now need to move 4 times faster than we currently are to achieve SDG 6 in the next 9 years, which itself is quite a frightening time frame. We also know that water quality continues to be a pressing challenge, and that's for a host of interrelated and complex reasons. And also, we need to continue to find new ways of unlocking funding and investment to close that massive financing gap of $114 billion that's required to achieve the SDGs by 2030. That all sounds quite challenging, and it is, but there's been a lot of good discussions this week about how to make progress in achieving the SDG targets and to enable communities around the world to live better lives. The purpose of this session is to add something into that mix of the discussion, to explore the opportunity of complementarity between the different water service models as a possible solution to delivering better services and providing people with clean water on a sustainable basis. The session brings together practitioners from pipewater and water kiosk sectors in Cambodia to analyze their respective strengths and to identify the ways in which the sector can be coordinated to achieve universal coverage. Before we dive into the detail, we wanted to share the specific objectives of today's session. We want to showcase the complementary value propositions of different service models through 3 case studies from Cambodia. We want to show how this complementarity could accelerate pace towards universal access to universal coverage to safe water, and to suggest how institutional support could foster expansion in the coming years. This is a joint session between partners active in Cambodia, and we'll hear from the following speakers today. We have Sokung Su, who's a program manager at WaterAid Cambodia. We have Mr. William Poyo, who's the general manager of Khmer Water Services Holding Company. We have Ms. Tara Michaels, who's the country representative of Gretz in Cambodia. And we have Julien Arcell, who's the CEO of 1001 Fontaines. I'd like to now hand over to Sokung, who will provide further context of Cambodia, a country that provides a unique opportunity to explore this complementarity.
Yes, good afternoon and also good morning from everyone where you are, and also thank you, Paul, for giving me this opportunity. And for the context in Cambodia, Cambodia is ranked at the 135th place in terms of access to improved water in the world. A huge disparity between rural and urban area, with 27% of the rural population deprived of improved water source, half of it relying on sewage water, versus less than 1% in the urban. Covering rural area has to be priorities, representing around 61% of the total population. In current situation, the prevalence of the basic solution, sewage water, rainwater, and underground water, it is the main water sources that the people are accessing and drinking. And the people often use traditional storage like the water jar to store their domestic treatment for drinking, like the boiling or filtration system. And they also do have strong cultural habit when they come to drinking water. Some people, they feel about the smell, and some people prefer about the tasting. Can you move to the next slide, please? And the low infrastructure coverage is only 37% of the village recently licensed, and 16% of the rural population relying on the pipe water based on the last population census survey. And overall poor water quality and for drinking, whether due to an improved water source and not really safely managed water supply, or inadequate behavior and lack of the awareness session. And the figure in the table come from the joint study that conducted by WaterAid and 1001 Fountain that illustrate how traumatic the situation is in the country. And the situation result in worse impacts. The quality of disinfection generate the significant public health issue. The starting with waterborne disease, including diarrhea, is the cause of estimate 10,000 deaths each year, and an estimate 298 million US dollar annual loss for Cambodia due to the adverse economic and effect of the unimproved water access. Despite the national target to reach the universal coverage, the safely managed by 2030, and the gap to fill is still the huge in the rural Cambodia. Thank you.
Thanks, Sokung, for setting the scene there of the impact in Cambodia. Now that we have a clearer idea of the Cambodian context, I'm going to invite 3 case studies from the other 3 partners. One is a pipe water supplier, one is an organization that has supported the institutional arrangements around pipe water service delivery, and one is a water kiosk pioneer, to learn more about these successful solutions that have been implemented over the last decades to deliver safe water in Cambodia. So I'm going to hand over now to William Poyo and invite him to talk us through a set of slides.
Great, thank you very much. I'm really happy to have this opportunity to participate and present a bit about KWASH and our activities in Cambodia. So to start, I'd like to give a bit of context on the regulatory environment, specifically for piped water supply here. So the situation today is that outside of key urban areas, there's the Ministry of Industry, which issues water licenses to private water operators, granting them the exclusive monopoly rights to supply piped water within the defined license areas. So this system has resulted in the emergence of over 400 private water operators, although less than half of them are actually licensed by the ministry. Now, these operators have done great work over the years in building out new networks, which many families have benefited from. However, today they face 3 key challenges due to the often informal nature of their businesses, which result in significant underperformance. So firstly, they often have weak management capacity, leading to poor corporate governance and low connection rates amongst the limited households that are covered by piped infrastructure. So for example, this can often be seen in the lack of company registration or absence of proper bookkeeping. Secondly, they often lack the technical expertise required to effectively set up and run these water utilities, leading to poor water quality or other inefficiencies which increase operating costs. So for example, many operators will seek short-term cost savings by installing low-quality PVC pipelines instead of high-quality HDPE pipes. Finally, they often face then, as a result of this, great difficulty in accessing the financing necessary to build distribution infrastructure to service the areas that should be commercially viable. And this is partly due to the small scale of their operations, but the previous 2 points on weak capacity and lack of technical expertise really exacerbate the situation by further reducing their attractiveness to outside investors. And as a result of these issues, many rural communities in Cambodia, which should be economically viable for piped water businesses, are actually excluded from this market as they are not covered by any piped water infrastructure. So the capacity of operators to scale up their businesses will be critical for improving rural access to clean water. And even within areas which are currently serviced, there are significant improvements to be made in terms of operational and commercial management. Turn to the next slide, please. So it's in this context that Khmer Water Supply Holding, or KWASH as we call it, was established in 2013 to expand access to clean and affordable piped water across rural Cambodia. So the company specifically aims to address the exclusion of rural households from the market by acting as an operations-focused holding company, which acquires private rural piped water utilities and then further invests in them to increase their production and distribution capacities and bring operational and technical know-how, which is critical to supporting their daily operations. So all these subsidiary stations are individually registered companies operating with their own water licenses, their local teams, and water treatment infrastructure, which will typically then consist of centralized production and distribution by pipeline directly to end users. So we end up with this basic structure between the holding company, the stations, and water end users, where you have at the station level, customers paying a one-time fee to have a water tap installed at their household at a cost which can usually vary between $35 and $70. Thereafter, they pay for their metered monthly water consumption with an average price of 50 cents per 1,000 liters, which generates a recurring revenue stream. And at each station, the expansion of the pipeline that we do, joined with enhanced customer acquisition, then facilitates greater economies of scale, improving profitability further. And then once the build out is completed, profits can then accumulate and be released to the holding company as dividends, where they fund the holding level expenses, as well as investments in new stations, thus creating a kind of virtuous cycle to increase accessibility of safe water across rural Cambodia. And the idea is that the holding company concentrates all of the costly activities such as fundraising, engineering and design, new station due diligence and acquisitions, financial reporting and procurement, and of course, overall oversight of the utility portfolio to ensure the application at all the stations of the best practices that we've defined at the head office for daily operations. Thus, by concentrating key management personnel in the holding company, KWASH amortizes this cost across a growing portfolio of revenue generating stations and efficiently allocates these human resources across the stations while also benefiting then from economies of scale in our supply chain as we grow. Next slide, please. So how has this idea kind of behind us panned out over the years? Well, we first acquired our first two stations in 2014 and 2016, which served as proofs of concept, demonstrating our ability to scale the business model. Then through 2018 and 2019, we acquired 3 additional license areas, of which 1 greenfield site. Throughout this process, then KWASH has reinforced its management team as needed to accommodate for the growth in the portfolio and the capacity needed to then grow further. So as of today, we have a strong platform with 5 stations with license areas with over 40,000 households across them, of which 15,000 are already connected. So the idea and our primary goals over the coming years are to continue driving organic growth in our existing portfolio by pushing all of their individual connection rates past 70%, and further growing our portfolio by acquiring and building out new stations. And it's our hope that these efforts will play a significant part in consolidating and professionalizing the sector to ultimately benefit water end users. Thanks again. I'd like to now hand over to Tara from Gretz.
Thanks, William. Likewise, it's great to be here and it's great to see so many participants. This slide shows a brief overview of Gretz activities for the past 20 years involving professionalizing piped water suppliers in Cambodia, primarily medium-sized and large-sized ones. You see there's a timeline here showing our projects going way back to 2000, before there was really any regulation, which is also presented in this slide because it's quite tied to the work that we do. So going back in the early days, there was no licensing. And you see in 2004, there was an introduction of 3-year licensing, which was then upgraded again in 2014. Now, as you see, in this period of time, projects expanded dramatically around 2014. Many stakeholders came in and tried to help all of these piped water suppliers professionalize. In that period, not only was regulation and policy increased, but it was very operationally expanded on the ground. So minimum technical standards, very extensive workbook of regulations which should be applied for construction, oversight, management of piped water systems was established in 2018, very recently. And this has allowed piped water suppliers to have standards to follow. It has also allowed the MISTI, the Ministry of Industry, to enhance their oversight of piped water suppliers. we've really leveraged this professionalization and the regulation alongside together to ensure that the private sector and the public sector are really interacting and speaking with each other. And as you can see, this is continuing and expected to continue in the future with revisions of the water law, which is relevant to this analysis, and will continue to connect with the other stakeholders in the sector. The next slide shows an overview of what William was talking about a little bit, that private water operators are quite often not professionalized. And so combining the minimum technical standards and all of the regulations in place, we created a series of tools to help them to upgrade, essentially. And so there's beginner sections, intermediate sections, and quite advanced sections because the operators actually vary quite a lot in their experience. So we have different packages that we've developed over time with the regulators to help improve and operationalize these operators. Along with these training programs and with the regulation that goes with it, we have supported them directly with detailed design, also professionalizing on that level, as well as implementing and connecting households at the end level. So it's quite a comprehensive program that spans across the needs of operators from planning to operation to investment and expansion. The next slide shows, thank you. The next slide shows the key findings of our Access to Finance program, which was initially funded by the World Bank and then was then taken over by the AFD and EU, which reached a significant number of operators. As you saw in the first slide, over time, operators have increased in number, and there's now more than 400. We've assisted more than 120 in Cambodia, and this program specifically enabled loans to 31 operators, totaling 7.6 million, reaching 18 operators reaching operators in 18 provinces, expanding 27 treatment plants, extending over 600 kilometers of pipe, and reaching more than 95,000 households. This has been a significant improvement in the piped water sector over time. And there's certainly, with the recent regulation and expansion, there's a lot of opportunity to continue to professionalize and expand these operators, especially the smaller and more informal ones as they pop up. With that, I thank you, and I will pass to Julien.
Thank you very much. My name is Julien Arcell. I'm the CEO of 1001 Fontaine. We started our action in 2005 and are focusing on safe drinking water for remote rural communities. So what we do is we create water production facilities inside the villages, and we empower local people, local entrepreneurs to manage those safe water stations like a business. So we call them water kiosks, and basically our entrepreneurs produce safe drinking water in 20-liter bottles that are guaranteeing the quality at the point of use. So they deliver the water at home, so they can reach the last mile in a radius of about 10 kilometers for a price below 2 cents per liter, which remains affordable for the communities they serve. And we manage the operations as a franchise to ensure business continuity and financial sustainability. So for example, we do for these entrepreneurs, and we have about 270 of them now spread around Cambodia, monthly water analysis. We do the maintenance of the site. We provide continuous sales or financial management support. And in exchange for those services, we collect 20% of the entrepreneur's revenues. So we call it a franchise fee, entrepreneur contribution, which enables to cover the costs at all levels of the organization. So maybe the entrepreneur, the platforms, the service platform, or our HQ. And the initial investment to launch those water kiosks, we're talking about $30,000 per kiosk, is subsidized. So today we are the largest safe drinking water producer in rural Cambodia, covering about 25% of the territory. We have reached break-even point, and by 2025, our plan is to address all Cambodian communes with more than 10,000 inhabitants. So moving to next slide. the way we approach our impact as a last mile distributor is on 3 dimensions. So first, obviously the health, this is our key mission. So we impact about 900,000 people today in Cambodia, and we've made evidence through epidemiological studies that we can have an impact on health, either on the reduction of absenteeism at school for children that was mentioned earlier on, linked to diarrhea, and also reduction of the number of diarrhea cases compared to other sources. We also have an impact on the environment because the fact of using of water changes the habits of people that were used to boiling water and therefore using charcoal. So actually we have been awarded by the UNFCCC the label to sell carbon credits. So we have sold last year about 70,000 tons of CO2 that we saved and that we can now sell in the market and integrate into our economic model. And last, we have an impact on the economy. So we have reached actually last month the threshold of 1,001 jobs created on the field. So obviously the impact on the livelihood begins to be important, and those are sustainable jobs over time. And one last thing about the impact is what really matters for us is the efficiency of our impact. So if you look at how much it costs to create a new water kiosk and how many lifetime beneficiaries we are creating, we are talking about a cost of $12 per beneficiary, which is very, very, I would say, optimized, and therefore has a potential to scale. Now we'll give the floor back to Sokung Sung, who will zoom again on the Cambodian context. Thank you very much.
Actually, we're going to move to a panel discussion.
Yes.
Thank you very much, Julien, and to the other speakers as well. Yeah, 3 great examples there of how the partners involved in this session have been supporting the delivery of improved water services in rural Cambodia. We're just going to pause there, as I mentioned, for a brief panel discussion. And you know, I'm really interested to hear from the panel actually. About this point about customer satisfaction and the value proposition that you're offering customers, and how they perceive that. So, you know, do you know why people are using your service specifically, and do you know what the alternatives are? William, what are your thoughts on that?
It's quite interesting, the idea around how exactly the customers perceive the piped water supply, because in our experience on the marketing side, we found that focusing exclusively messaging around health benefits and things like this don't tend to move the needle very much, especially for households that are using a water source that has been satisfying their needs for a very long time and they haven't faced any particular issues with. And in the end, we find that, especially through surveys we've done of our existing customer connections, that the biggest value propositions that they value the most end up being matters around convenience of access, reliability and availability of the water, especially in areas which face risks of droughts, which affect either the surface water which they're collecting or the well water which they're drawing from. So that definitely affects the way that we have to present the value proposition to our customers. On top of which is, as was touched on a little bit before, the fact that many Cambodian rural households have an aversion to the taste and smell of chlorine, which is a key component required for the actual proper treatment of the water. So you'll find that some operators will be rather opportunistic about this and either reduce or entirely skip the chlorination process of the water just to satisfy and sell more water, even though it should not really be done that way, and instead should be focusing on raising awareness of the requirements and why that's necessary as part of the treatment.
Interesting. Julien, any sort of further comments on that?
Yes, we have the exact same starting point and analysis. So regarding the focus on convenience and the distress in chlorine. So on our side, our customers really are clearly identifying the product with drinking water. So actually 94% of our customers are exclusively drinking our water. And in the opposite, 85% of our customers are not using our water for cooking, but rather using either tap water or well water when it's available. So there is definitely a clear identification, and I would say a trust in our quality, and they like the taste because it's not chlorinated and it's mineral. So yeah, obviously now if we look at the customers surveys we've done a couple of years ago, the 2 main identification patterns are the price, because it's affordable for them, and second, the convenience of being delivered at home. And there is a clear comfort for them and not to have to fetch to the water or to go to the water point and work for that. Thank you.
And do you both know and understand what the alternative sources of water are that your customers are using? Do you track that data?
Yes, on our side, we do it. So when it comes to drinking water, so we have two main competitors. If there is no other, I would say, bottled water provider available, mostly it will be either pipe water or solutions that are spread out, for example, ceramic filtered that can be used. Otherwise, there are other bottled players that are very active as well. They can have some advantage sometimes because sometimes they can price lower. But still we are in, I would say, in a dominant market position. And yes, we are trying to push basically our positioning in a much more, I would say, competitive market.
To add on that, yes, so from the perspective of the piped water operators, you know, the vast majority of our water sales comes not from drinking water, but from all the other uses of water. So cooking, cleaning, sanitation, other household uses. So, you know, we do have a certain amount of, not direct competition, but, you know, bottled water being an alternative where households focus on in terms of the quality assurance that they would like for drinking water, even though our piped water is of a high enough standard to be drank directly. But in terms of the bulk of our volumes, our main kind of alternative sources that we face against are the traditional alternative sources you'll find in rural areas. So that will include surface water collection, well water, boreholes. In some areas, it can be delivery by truck if there's no alternatives available. And because of that, you know, that much larger volume, that's why they do tend to favor matters around convenience. So if we're in an area where there's a dominance of good quality well waters, that will be a more significant marketing challenge for us compared to an area where everyone is relying on deliveries by truck, which are of unknown origin and quality and extremely unreliable and time consuming.
Yeah, that's really interesting. Thank you. I'm just thinking a little bit, I know, William, you touched on this in your presentation about the sort of fragmentation a little bit within the sector. Tara, Sokung, interested to hear your thoughts on how that fragmentation plays out in the delivery of sustained water services. You know, do you have any comments on that? Maybe Tara, you can go first.
Yeah, sure. Yeah, I think, you know, we've seen a lot of evolution in the water sector, both rural and urban, as we talk about it in Cambodia. And I think, you know, until now, it's been very piecemeal. You know, there's different donors coming from different perspectives, different operators, different communities, trying to come at this from their needs, their community needs, or the opportunities with surface water, or the lack thereof. We're finally actually reaching this point where we really need to have this dialogue, because we're coming together, we're crossing over. And so there's a real need to have this discussion with the stakeholders and the partners like ourselves.
That's great, thanks. Sokung?
Yes, and I think add to what our colleague mentioned, I think the same like the Tara mentioned in terms of collective way of working, in terms of multi-stakeholder collaboration. And it is can support to make a sustainable water supply service in Cambodia. And if you look into the challenging community and in very remote area, we could see value in terms of the different contexts. We need to have require different solution that can be appropriate technology that easy to rural community, especially the most marginalized people that can access in terms of the cost, technology, and also accessibility. Thank you. Yeah.
That's great, thank you. And before we move on to kind of discuss a bit more detail about the complementarity between the various models, just really interested to hear from all of you, in fact, actually, just what level of engagement do you get from the public authorities, from the various ministries and various local government departments in your service, you know, as you deliver your services? Do you have good relationships? Do they play an active role? You know, what do you see out there? Open the floor to the whole panel to comment.
So maybe I will start. So on our side, being a rural player, we are working hands in hands with the Ministry of Rural Development. So we are working under a MOU. So basically, together with the MOU, we select the areas, we select the commune. They support us when we enter the village to engage with the communes. So that I would say we have a national level agreement, and they're being very supportive. And locally, we are working with the communes. So it's a community engagement and basically a tripartite contract between ourselves, the entrepreneurs, and the commune. So really, I've built a system that's deeply integrated, I would say, in the communal pattern.
Great, interesting. William, any thoughts?
Sure. I mean, as license holders for piped water supply, our official regulators are the Ministry of Industry. So at the national level, they will be the ones handling everything around the licensing process and renewals and tariff setting, for example. And they do also regulate us through the provincial departments. But on a kind of day-to-day basis, a very important part of our engagement is directly with the local authorities. So village leaders, commune leaders, district leaders, etc., because they tend to be the main avenue through which we can ensure good communication and information sharing with the local communities which we're servicing, because we do provide a very important public service in those areas. And one good example actually would be that very early on, we found there was some gaps in understanding between the tariff level of the water that we were supplying, because it's set by cubic meters, so 1,000 liters, and no one really knew what that actually represents in terms of what you're paying for and what you get. And there was a bit of a language issue in that they were comparing it with the tariff for a kilowatt of water, because they're referring in Khmer to it as a kilo cube of water. So they thought there was much more expensive, the water supply. But then when we kind of converted that more into the equivalent tariff for like a 20-liter bottle, which is something they're more familiar with, suddenly the perception changed a lot and they understood how truly cheap it was. So that kind of awareness raising at the local authority level is a very important part for us.
Great, thanks. And Tara, Sokung, any sort of final thoughts before we move the conversation forward?
Yes,
sure, yeah.
I think, okay.
Go ahead.
Okay, I think in terms of context in Cambodia, like Julien mentioned, in terms of the Ministry of Rural Development, they had the mandate to manage for rural water supply, and the Ministry of Industrial, Scientific and Technology, who are take the mandate for promoting pipe water supply, especially in the urban side. And the both ministry try to make some improvement for promoting the pipe water supply. And through the World Aid, working with other sector actors, that especially a Cambodian Water Supply Association, that it is the umbrella of the pipe water supply service provider that can bring all of them to work together. But it's still some room for improvement for better coordination is the key area. And another one that we can consider in terms of the mobilize the more women to raise about the decision making or take some contribute into the water supply. It is the area that we should be consider. Thank you, Tara. Please continue.
Great. I think in the interest of time, we're actually going to move on the conversation just to make sure that we leave enough time for the Q&A at the end. So yeah, 3 really good examples there of partners working actively in the sector and demonstrating where their models are being successful. You know, Julien mentioned earlier, 1,001 Fontaines reaching OPEX break-even in 2019, for example. It's a major breakthrough for providing sustainable service through its social franchise kiosk model. But what we've seen increasingly over the years is that there's actually a great deal of complementarity between the different approaches. And so Sokung now is going to highlight the importance of this complementarity and how we think it might work. So Sokung, over to you.
So thank you, Paul, and then can you please move to the next slide? Yes, and again, thank you. And through our investment in the Cambodia context and with our stakeholder and partner, and we could see if we look back to the last 15 years, and then the connection to the pipe water supply is grown from the 1% to the 16% of the rural household. And whilst there is the collective alignment that pipe water supply is the most convenient supply solution, it seems the realistic that to move to 100% coverage exclusively through this solution. And betting to complementarities, the only way that currently to ensure that no one will lack to access drinking water by 2030 based on the SDG commitment. We could see the pipe water supply for the density area admin like the Crow Center that so many people in that, and then they can fulfill all the water needs. And for the some money, the rural remote area, especially the challenging area that density is very low, the pipe water supply may be very technical, feasible, and hard to reach in terms of the costing for extension, the width, and also the cost for accessing. But with that situation, and then the bottled water, it is a very appropriate technology that can really accessible and cost effectiveness for the rural challenging community, and home delivery system that can to address the water drinking need and to the last mile. So the combination between the both options is optimize the investment and also contribute to speed of the deployment. Could you please move to the next slide? Yes, it is the practical experience that both Ed and our partner working in one challenging province that we call the Kampong Chnang province. That is the one province along the Tonle Sap. So on the left figure, so about the comprehensive that require the different context, need a different solution and also need a different action that require the government and also the sector actor to play, should leverage the private sector that can contribute to provide the water supply in the vulnerable community. And based on our study that we did with our survey consultant company, we could see that the 39 of certified commune in Kampong Chnang could be fully serviced by the system with appropriate support from the water supply. And build on the study that we did in Kampong Chnang, we informed to create the decision-making tool, or we can say the decision-making tree that can support the local authority and also the key sector actor to play in terms of increase the investment for our water supply. And for example, if you could see the diagram from the new private pipe supply. So if to reach out to this solution, it means that when the pipe system is an option that has the most potential to deliver a safely managed water service with the proper quality and control, also the awareness, but the people are not yet connected. So there is enough demand for it and the variable, but it is possible that can promote the more investment opportunity. And if we could see another example in terms of the existing pipe, when the local authorities decide to choose the option, when a pipe system is an option that most potential to deliver a safely managed that can support existing pipe for better service and also increase connection. And if you look back about some community that challenge and then also the pipe system that cannot reach out, the local authority or other sector, they can consider the existing or new bottled water sources, that when the family integrate area have enough the quantity of water for all domestic, but they need to require the affordable drinking water quality. For example, like the commune A in the left figure demonstrate that the commune is an uncovered area and also low budget allocation to water service, but the access to water for domestic usage is not an issue. So the recommendation for decision is the bottled water sources. But in another situation, for example, like the commune B, that is also the uncovered area. But if the local authority, they have around the $30,000 US for operating the project, and the size of the community is around 400 family, the recommended water supply solution is a private PEP water supply service. Could you please move to the next slide? And in the long term, building on the integrated the model for potential, if we can provide opportunity for one operator, they continue to supply both pipe water supply and water supply, it will be increase and also impact the more benefit to the community in terms of the mutualizing the resource, can increase in awareness and also the collective cash and also the quality monitoring. And in terms of the mitigation seasonality effect, it means that it can support to people that can access available water sources for the all year round, and also can serve all the need of the people. And knowing that in the increased adverse consequences of the climate change related, for example, like the flood or drought, so the bottled water service can ensure continually. For example, like in Kampong Chnang, they have some different geography, like some in drought zone, some in flood zone, and then the bottled water they can deliver during the flood zone by boat, and it is easy access to the people. Thank you, Paul. Going back to you. Thank.
That's great. Thanks, Sokung. That's really helpful and useful analysis. And I think what's really interesting is the analysis that's been undertaken by a few sector players now in Cambodia, the World Bank, kind of Gretz, WaterAid, 3i, to kind of map and understand the viability of different models in the different provinces. You know, that colorful map that you showed is really useful. You know, and I think it challenges the sector to think about how the finance that is available to the models, that is channeled to the models that are best suited to those specific contexts, you know, particularly ensuring that grant funding, government subsidies are used to support those hardest to reach areas. You know, I think it's interesting as well that, you know, the reality is in any one province, in any one context, you know, there are going to be pockets of populations that aren't going to be, it's not going to be financially viable or economically viable to provide pipe water services to them. And I think this is where that complementarity comes in. You know, the partners that have organized this session have over the last 6 months been really analyzing this topic of complementarity to better understand it and to consider what else can be done to foster it. The analysis has identified a set of sector level challenges, and as you would expect, given these models exist within a system anchored in the country context, they're fairly familiar. You know, there's a lack of monitoring and enforcement of existing regulations around quality and coverage. There's a lack of coordination between the different authorities. You know, very common to see different entities having overlapping mandates, which can be challenging in the context where those authorities aren't speaking to each other or don't talk to each other. There's generally no up-to-date centralized mapping of existing systems, and I think there's been a big effort in Cambodia to do that. I know certainly 3 provinces have been mapped in the way that Sokung has presented. And there's, you know, there are the incentives and technical support around encouraging operators to provide services to those most, you know, challenging areas towards the poorest. They're not always there. And you know, we have to overcome certain barriers to challenging some of those perceptions of the poorest being good customers. You know, for many on the call, these challenges are common, and they'll be common in many of the countries where you operate, and they tend to span both urban and rural contexts in reality. But we share them because the partners have identified a set of recommendations coming from the work that's been carried out, which we want to share with the audience. And I'm going to hand over now to William to talk us through the first of those, and he'll hand over to the other partners as well. Over to you, William.
Yes, thank you very much. So in fact, we do face a few key challenges within the regulatory framework. So first of all, there remain weaknesses in the enforcement of quality standards for operators, especially piped water operators. So for a long time, the main requirement specifically for piped operators has just been to submit a sample of treated water quality to the local authorities, which is then submitted for testing at the laboratory in Phnom Penh. However, at KWASH, for example, we have always tried to go above and beyond our basic legal requirements by implementing additional procedures. For example, our internal requirements include daily quality testing for key parameters at the point of production, as well as quarterly testing at the household level. So the daily testing ensures that the water quality consistently falls within the acceptable parameter ranges, And the testing at the household level ensures that there's still sufficient free chlorine content at the household tap, since it partly evaporates during the distribution process in the piped network. So our internal standards have meant that during this time, we've been taking on additional expenses, which other operators have not had to contend with. But we strongly believe that it should be an integral part of piped water management and puts us in a strong position for the future. That being said, there actually have been recently some updates from the ministry with new requirements being rolled out from this year to impose this kind of daily testing of key parameters on all the piped operators, which we view as a very positive development. Bottled water operators, on the other hand, do not face the same compliance requirements as they are not licensed in the same way piped water operators are. As a result, the water quality can vary quite significantly between different bottled water suppliers, with little means for households to verify the quality and origin of what they're actually consuming. So we would therefore encourage, firstly, the generalization of the licensing process to cover all water operators. And this would involve enforcing commonly applied quality standards through a public water agency and testing facilities. And with these objectives in mind, appropriate technical assistance programs to enhance operator capacity would go a long way towards ensuring this kind of compliance from all operators. Thank you.
The second point is regarding public planning. As Paul mentioned, there's been some efforts recently to map and understand these gaps that I also mentioned earlier. We have the Ministry of Rural Development and the Ministry of Industry who are basically, they have the same mandate, but it's in very different approaches. And actually both of them manage piped water supply. Some are just community-led and others are commercially led. So the idea is that a national investment plan or a goal to bring these two stakeholders in particular together and bring the private sector and the public sector, and when I say public sector, I also mean community piped water systems, together to actually have a discussion. And of course, we're talking about bottled water here as well as rural solutions like wells for households that are truly out of reach. So there's a need to have a dialogue with these stakeholders and our implementers together to understand the gaps in the maps and the approaches. In particular, one concern is that licenses for piped water suppliers are drawn by administrative boundaries. But the reality is that you need a mix of rural solutions, as we would call them, and piped water solutions to meet administrative boundaries, because sometimes whole villages or households are actually quite isolated. And this was some of the results that we've seen in our studies, which drew a lot on WaterAid studies, as well as the study done by 3i. The second component is empowering local authorities. In our experience, the Ministry of Industry is actually very motivated and very involved, including at the provincial level. At the local level is quite mixed. We really need inputs from commune authorities, district authorities, and so forth, to promote water supply solutions all around. And we actually have seen in our projects that sometimes water operators are more involved and they're quite successful, but also when commune authorities are quite involved, the expansion and extension of water supply reach can also be quite impressive. So there's a need for both of these things at the public planning level.
Thank you. Funding obviously is the key issue. So while not specific to Cambodia, the difficulty to secure the needed funding is obviously a barrier to universal access. So each of us as water operators, we have to face high transaction costs to identify the relevant investors, go through their own processes. So the water supply project, they also require long-term tenders and reasonable expectation of returns, which are sometimes not aligned with the needs from the market. So we believe as a team that there is an opportunity to set up a water fund for Cambodia, which represent approximately $250 to $300 million to unlock by 2030 infrastructure expansion, reinvestment, and sector consolidation. So that's a lot of money. But if you compare that to the $300 million annual economic losses that were mentioned by Sokun, that's actually a good ROI. So it would leverage blended finance with a combination of subsidies, concessional, commercial finance. And as an illustration of how it would have benefited for us, we are in the process of raising about $7 million USD for our 2025 business plan. And we've been confronted by the atomization of the funding market, the absence of tailored off-the-shelf solution for hybrid financing. So it would definitely, I would say, support and help us to scale and focus on our operation and execution. And the last recommendation is really on the objective to leave no one behind and to ensure targeted subsidies for the most vulnerable households. And we've seen that particularly during the COVID crisis and the upsurge in poverty. So either may it be in connection for pipe supply or initial deposit for bottle in our case, and that would remove some critical barriers to entry and foster capacities of operators to fund their expansion, especially in challenging areas, more remote areas where we would not naturally go because of the limits of the economic model. So as an illustration, we have actually decided this year during COVID to subsidize for ID poor populations, so the poorest people. More than 15,000 households have been provided with free jugs and free refills to help them sort of enter the category, because we know they couldn't access it at this time. So it's been fun. We have set the funding mechanism. It's initially a COVID response program, but it's demonstrating the possibility to reach out the poorest with a simple scheme. And now it's time, we think, to sustain that and structurally integrate that within the national policies. Thank you very much.
That's great. Thank you. Thank you to all of you for those recommendations. You know, I'm just going to wrap up the session now and give us time for a bit of a Q&A, because there's a few questions that have come through. You know, I think what's really interesting is, you know, while in many ways a unique country context, we believe that Cambodia demonstrates what's possible if you bring together the right market conditions, and that this and elements of this can be valid, we feel, for other geographies. It demonstrates that water supply options don't necessarily need to be in competition with each other, but could be integrated in more joint strategies to achieve the highest level of impact and ultimately universal coverage, which is what we're trying to achieve through with the SDG target. The partners will be publishing a position paper, which has summarized the analysis and some of those recommendations, which has been co-authored by the 5 conveners of today's session. So, and we'll communicate that shortly, and we'll be pleased to share it out with all of you. So please do get in touch with one or all of us, and to make sure that we get that publication out to you. We're just going to wrap up today's session. We've got about 9 minutes left, with a quick Q&A. Thank you to all who have provided questions via the Pathable chat function, and it's not too late. We are going to have to pick a couple because of time to make sure that we get into a good discussion. You know, one really interesting question that's come through is that, is there any risk of competition? I mean, I've just said that there isn't, but it'd be good to hear from Julien and KWASH in particular. You know, is there any risk of competition between your different service models, and how might you work collaboratively to plan more strategically around how you deliver better services in the areas where you're working?
Yes, thank you. So maybe I will start and then I'll leave it up to William. But we've you know, experience in the field. What the field tells us is that we really need to think complementarity and not competition. So we don't consider competition at all. And our dream is rather to build integrated model and think about a way that our approach could be integrated. Because if we could imagine a system whereby we could co-manage the different those essential services, for example, having mutual technicians, or you know, on the OPEX side, that would definitely improve the quality and reduce the cost. And if you look at on the customer side, having differentiated branding, differentiated means to promote the water based on the usage. So if we could build an integrated commercial and industrial system, we believe that we could have more impact, more penetration, and reduce costs. So it's basically the opposite of a vision of competition that we have within 1,001 Fontaine.
Yeah, so if I can add to that, you know, I think I mentioned a bit before the fact that from the pipe water operator's perspective, the volume of sales for drinking water is relatively insignificant compared to the bulk of the sales that we do for all the other uses. So from that perspective, already there's not an enormous amount of concern around competition. That and, bottled water operators are able to target market areas that private water operators simply cannot, getting to that last mile distribution, those most rural, those most remote households. And as Julien just touched on, there are a lot of opportunities for us to start sharing common resources on the technical side, on the marketing side. Mm-hmm. So there's no real concern for us from that perspective.
That's great. Yeah, thank you. And actually, a follow-up question, Julien, specifically for you, is somebody's asked about the limit around the 10 kilometers. Why is that important for your model, and what impact does that have on achieving the social impact that you're trying to have?
Yes, so we have to, the 10 kilometers is actually quite important, because most traditional programs, especially bottled waters, will not deliver at home. So it's actually a competitive advantage that we have, and we cannot go further those 10 kilometers because otherwise, from a cost perspective, transportation costs, it wouldn't fit within our model. So the way to approach more remote communes is basically to rely also on shopkeepers. So what we will do is we will basically target our radius of 10 kilometers with our sales team, and then for the more remote people, it will be through shopkeepers. But if you look at Cambodia and the geography of Cambodia, that system, being present in all the communes of more than 10,000 inhabitants, basically would enable to cover about 80% of the territory with our system. So it connects with the way Cambodia is structured, basically.
Great. No, thank you. Hopefully that answers the question. A question's been asked about whether any financial support is coming from government, whether that be at national level or the local level. And it'd be really interesting to hear from Tara and Sok-Hung. What are you aware of? What do you think might be possible? How is the government responding to the needs within the sector in terms of channeling finance towards that? Maybe Tara, if you want to start off.
Sure. Excuse me. Yeah, it's a great question. And it's actually very relevant to some of the mapping and complementary work that we've done, because the Ministry of Industry is really seeking to identify public-private partnerships in the expansion of piped water supply. They really want to encourage operators to expand, densify and expand, I should say, because both are really necessary, but also trying to identify locations where there's a possibility, but a limitation. Perhaps it's a slightly more scattered households, or slightly more rural, or actually really water source issues are quite common, and that's the only potential. So in a sense, there's areas where there's one restriction, but not really others. So I know the public-private partnership scheme and various different donors are discussing on how to support the expansion of these piped water systems that way.
Great, thank you. And Sok-Hung, any sort of final thoughts on that?
Yes, and connecting to the financing is just the one area, I think not just only contact in Cambodia, but some area also fetching in terms of the resource mobilization to support water supply service. And based on our experience, I could see if like the Tara mentioned, in terms of the public-private partnership, and also the government itself increase more ownership and political leader that can share the commitment to invest more financing, so that can decentralize to subnational authority to increase their own capacity and their decision making in terms of allocation their local resource for the service. And another one side, we could consider in terms of the resource mobilization or self-supply, that we can promote the community to better understanding what is the role in terms of contribute to the investment and access to the service. And another one area in terms of the 3T, we call it the tariff transfer and tax management. If the government and also the private can work together to improve in that area, I hope in the future every people that will have enough water to access, and our target SDG will be reached. Thank you. Yes.
Great. Well, thank you very much. I think we need to be conscious of time. We don't want to be one of those sessions that overruns and forces people to be late for the next one. So I think on that basis, we're going to wrap up now. Just to say that the partners here will be providing the publication that I mentioned earlier. I think we're looking to potentially pilot an integrated model approach in Cambodia collectively, and also looking to work with other sector actors in Cambodia around some of the advocacy points that we talked about, some of the policy recommendations. So just to let you know, that's the sort of next steps, plan next steps. Final thing is just to say thank you very much for everyone who's attended today's session. Hope you found it interesting. Please do reach out to all of us to follow up with any questions or any additional information that you may need. And I just want to thank William, Tara, Sokung, and Julien for their time today. And yeah, hope you enjoy the rest of World Water Week. Many thanks.